Welcome to this track for estimating disease burden of seasonal influenza. This track is designed as a tutorial for the WHO manual on this topic, and it is part of the online course for estimating the impact of influenza. Globally, acute lower respiratory infections are the second most common cause of illness in all age groups. This accounts for over 400 million cases in 2004. They are also the third common cause of death, accounting for over 4 million deaths in 2004. And most of these infections are caused by viruses. Respiratory syncytial virus and influenza virus are associated with the majority of episodes of these infections in children and the elderly. Influenza is an underreported contributor to global mortality and morbidity, and it has significant economic consequences. Current estimates indicate that each year, seasonal influenza affects 5 to 10% of the world's population, resulting in several hundreds of thousands of deaths. Influenza is considered the second most commonly identified pathogen in children with acute lower respiratory infections. It is estimated that in the United States during 2003, there were 24.7 million cases of influenza. And this resulted in 31.4 million outpatient visits and over 300,000 hospitalizations. Ultimately, it led to over 40,000 deaths in the United States that year alone. The economic burden of influenza for that country was estimated to be 87.1 billion that year. However, such detailed estimates are not available in most countries. There is a need for reliable disease burden estimates, especially from low and middle income countries, to provide a better understanding of the impact of influenza in vulnerable communities or subpopulations. These national estimates, if readily available, would enable governments, non-governmental agencies and philanthropic donors to make informed evidence-based decisions when allocated scarce resources. And it would allow better and more focused planning of intervention strategies to limit the spread of the disease and to minimize associated costs. Let's listen to Dr. Gideon Emukule explain why estimated burden of seasonal influenza is important for countries.
As you implement programs or interventions to combat disease or to mitigate disease, you need to be able to quantify, to understand what you're dealing with. Until recently, the burden of TB was not clearly understood in Kenya. The current estimates now show that about 6 in 1,000 Kenyans have TB, as opposed to previous estimates which showed that about 2.5, they're about in 1,000 had TB. And in fact, I remember one media house reporting that the burden of TB had doubled. You can understand where they're coming from. It's not really doubling. It's that the burden was not just well understood. So it's important, extremely important for countries to understand what they're dealing with, because it's only then that you can now make policy recommendations, develop strategies to control, for example, for the case of influenza, to understand which segments of the population are mostly affected and how then can you respond in trying to control this. In the monetary terms, you only do that with burden estimates. If you consider things like cost effectiveness analysis, those are bases upon which, of course, looking at burden data, you're able to determine whether the program that you're going to implement is worth it or not. Okay, so the bottom line really is that you have burden of disease data.
This track is targeted at epidemiologists and data analysts with basic epidemiological training, who are responsible for data analysis and interpretation at influenza sentinel surveillance sites and the National Surveillance Office or the Ministry of Health. Though this course is for all WHO member states, it has been developed with a focus on low and middle income countries. This track on disease burden estimates will equip you with the knowledge and skills to identify the various sources of data for influenza disease burden estimation, to assess the quality and the suitability of data for disease burden estimation, and to estimate influenza disease burden in the general population as well in those with specific conditions who are vulnerable to severe disease, for example, pregnant women, and select chronic medical conditions like asthma and diabetes. And finally, this course will help you to interpret the results better after taking into consideration the limitations in data and the method used in estimating the burden of disease. We hope that you will enjoy the track and that you will meet many colleagues online who are doing similar work in other countries. And we hope that you will exchange views and experience. So let's get started.